Hey everyone, it's Moy, and in today's video we'll be covering 5 essential neck stretches that every massage therapist should have in their toolbox. Whether you're a seasoned pro or just starting out in the field, these stretches are crucial for promoting relaxation, relieving tension, and enhancing your client's overall well-being. Before diving into our first stretch, let's prep the neck by gently pulling traction on the neck repeatedly. Also, it's a good idea to assess the neck's range of motion for comparison post-treatment. Now, let's get on to stretch numero uno. Ask your patient to completely relax their head, as this will be a passive stretch where you, the therapist, do all the work. Locate the apex of the triangular area formed by the SCM muscle and trapezius. Apply pressure with the pads of your fingers, not the tips, where the tips can feel a little stabby or pokey. Then, gently turn the head until you feel the patient's range of motion is maximized, ensuring the head is fully supported by the opposite hand in the same position. The curvature of the index finger and the thumb should rest comfortably over the ear. Avoid crushing or folding the ear for the patient's comfort. For slight variation, tilt the head slightly laterally before performing the stretch. This modification is particularly useful for patients with limited range of motion or hypertensive muscles. Remember to move slowly and precisely when dealing with the head, envisioning graceful and effortless movements, kind of like a ballerina. While the head rests on the opposite hand, incorporate some petrissage, stripping, and effleurage techniques after each stretch to add elegance and interest. Now, let's move on to the second technique. Let's begin with a gentle tilt of the head laterally, allowing it to fall naturally. Starting on the right side, use your left hand to locate the apex of the neck's triangular area as mentioned earlier. Hold this point, aiming to maximize the head's turn with a gentle downward drive, as if pulling the chin towards the shoulder. Simultaneously, use your other hand to apply pressure directly on the head of the shoulder, ensuring not to dig the thumb into the humerus. Maintain a firm yet gentle grip. Hold the stretch from 10 to 20 seconds, and continuously communicate with your patient about intensity, ensuring they feel comfortable and in control. Remember, elegance is key throughout the maneuver. When returning to the starting position, get creative. Try releasing the shoulder first, allowing a smooth effleurage along the trap and the neck using your thumb on the origin points. Then gently guide the head back to a neutral position with a slight extension of the neck. For an added dynamicism, consider freestyling with this technique. Experiment with different pressures and holds, alternating between stretching the shoulder and the head first. Keep the muscles warm with continuous strokes, ensuring the skin maintains a healthy, light pink hue. Massage therapy is a personalized experience. Don't be afraid to have fun and explore creative approaches. If you notice your patient's chin hitting the shoulder too soon, simply ask them to drop the shoulder to create more room for the stretch. Now, let's move on to stretch numero tres, which offers both a passive and active variations, starting with the passive version on the right hand side. Using your left hand, reach under the head, just below the occipital knob and slightly to the right. Anchor in the origin of the trap, using your middle and ring finger. And control the head by curling the fingers and flexing the wrist slightly. With the pad of the right thumb, press into the trap while simultaneously turning the head the opposite direction. The pinning effect of the trap at the muscle belly combined with the motion of the head creates a stripping effect. Once you have reached the full turn, finish your stroke with the thumb until you've reached the acromion. Repeat this motion, starting with the lighter pressure and gradually increasing the intensity. The wrist lifts the head off the table and drives the chin towards the shoulder slightly, intensifying the stretch. Here are some shots of the pin and stretch on the other side. As a quick note, make sure to avoid pressing into the throat with your thumb when moving and controlling the head. It can be uncomfortable. It's safe to keep it on the SCM or below. As I'm sure you already know, but it's always a good friendly reminder to ensure a transition out of the technique with a nice finishing touch. For example, I like to include a little bit of neck extension and slight traction. There's no rules, so be creative, have fun. You don't want your massage to feel clunky or abrupt. Before we dive into the active version, let me drop a quick question. Would you consider subscribing? If you think I've earned your sub, hit that button with a little tapotement. You know what I'm saying? If not a big deal, no worries. We'll still have a blast together. Alright, enough about that. Let's jump into the active version. Now, let's break this down as simple as possible. It's just as hard as understanding quantum mechanics, trust me. Apply pressure with the pad of your thumb and instruct your patient to turn their head as far as they can manage. That's it. Easy, right? If the patient seems to struggle to reach the end of their range of motion, you can either soften the pressure a little bit or lend a helping hand with the other hand. Alright, let's move on to stretch number 4. This stretch is probably my favorite, not only because of the effectiveness, but also because my buddy Jared introduced it to me. Shout out, my boy. Position your hands right behind the mastoid process and lateral occipital bone. Press your palms into the head and create a swivel effect while simultaneously lifting the head off the table. For patients with excellent range of motion like this one, I place my elbows on the table for an added support. The key here is to tell them to play dead, allowing you, the therapist, to do all of the work. I often like to tell them, let the weight of your head pour into my hands. Hold the stretch for 10 to 20 seconds, and please, for the love of God, let the head down slowly and delicately. Patients often report feeling the stretch all the way down the mid-back. That's how you know you're doing it right. Now, on to the best for last. Stretch numero 5. Oh, real quick. Remember not to repeat the stretch too soon or too rapidly. Take a moment to incorporate some petrissage in between stretches. Okay, now for real this time, numero 5. This stretch may seem a bit more complicated, but I assure you, it's not, I promise. Start by positioning the stool high enough where your legs are bent at 90 degrees. This is important. I'll tell you a little bit later. Drop the table so it's hovering just over your knees. Then cup the head and ask your patient to shimmy upwards towards the head of the table. Make sure to instruct them to clamp the sheet to the side of their body with their arms to avoid exposure. The perfect stopping point is just above the spine of the scapula. Place your legs directly under the head for an added layer of safety and support. See? Told ya. Take a moment. Then remove your legs from under and let the head drop ever so gently. Check in with your patient for comfort levels. Let gravity do its thing for 10 to 20 seconds. I also like to encourage the patient to keep the mouth at a light clench. It intensifies the stretch, I don't know, maybe 2%. Bring the head back to a neutral position and return the legs under the head. I like to let the head rest on my legs because hovering the head can seem a little uneasy and cause maybe a little vertigo. Take a moment before each stretch, rinse and repeat. For an added layer of dynamicism, apply some effleurages with a downward force on the upper pecs to intensify the stretch. You'll definitely feel it going up into the neck. This kind of also gets the platysma involved a bit. For those of you who stuck around into the end, I've got a little bonus technique that's going to leave your patients coming back. Head traction. Here's how it's done. Roll up a rectangular towel into a nice snug noodle shape, or a pillowcase works just as well. Now, ask your patients to lift their head and slide the noodle underneath their neck, right under the occipital bone. Here's where the magic really begins. Gently lift the head first to explore some neck extension. And as you release, start pulling some neck traction on a firm overhand grip, placing your thumbs on the forehead for added stability. Now, this is the important part. You do not, I repeat, you do not need a lot of traction to be effective. just 10% is plenty. Of course, always check in with your patient for any discomfort. Remember, the amount of traction that's safe can vary greatly depending on the individual's factors like age, medical history, and existing neck conditions. In some cases, even light traction can be harmful, especially if there's underlying issues like cervical spine instability or cervical disc herniation. As responsible massage therapists, it's crucial to thoroughly assess the client's medical history and current condition to ensure that traction is safe. Cool. Alrighty. That's it, folks. Thanks for watching. If you enjoyed the content, don't forget to subscribe and hit the like button if you found anything in this video useful. That'll really help me out. Sending you all much love and good vibes. Till next time, peace out.